everyone. I'm Dr Malini, a consultant obstetrician at Fernandez Hospital. I'm here to answer frequently asked questions about changes in your body during pregnancy. Hormonal changes during pregnancy can cause body alterations, including skin changes, mood swings, and other symptoms. Today, we'll explain some of these changes and offer easy solutions. Pregnancy hormones can cause your skin to darken in patches or all over. You might notice a line down your belly or darkened nipples and birthmarks. Don't worry, most of these changes fade after your baby's birth, although some might stay forever. Morning sickness caused by rising hormone levels can hit at any time, not just in the morning. Eat small meals, avoid strong smells, and try ginger to ease it. Pregnancy can be overwhelming, causing you to feel emotional and irritable. This is normal. Talk to your loved ones and, if needed, speak to a healthcare professional. Cramps, especially in your legs at night, are common. Gentle stretches can help. You can sometimes feel faint when pregnant. That's due to hormonal changes affecting blood flow. Stand up slowly. If you feel faint, lie on your side. Tiredness is normal too. Rest as much as you can and eat healthily. Pregnancy makes you feel warmer because of hormonal shifts and increased blood flow. Wear loose, breathable clothes to regulate body temperature. Varicose veins are another common change. Keep your legs elevated and try compression stockings. Your breasts leaking during pregnancy is just colostrum, your baby's first milk, and is completely normal. Constipation is a common complaint during pregnancy. Eat high-fiber foods like fruits, veggies, and whole grains. Drink lots of water and stay active. If iron tablets are making it worse, ask your doctor for alternatives. I hope this helped you understand changes in your body during pregnancy. Comment or message us if you have any questions. Thank you.